Right now, we have an outbreak of mumps in the Auburn School District. We currently have 101 cases out of 16,000 students. In my 29 years of school nursing, I've never seen anything quite like this. Pretty much unprecedented.
Hi, this is Kristen from Public Health. I'm just following up on one of your students who was a mumps case. And
Public Health is a fantastic investigation team. When, as a lead nurse, I send in every time we have a new probable case of mumps, and then Public Health will investigate that, their contacts, their vaccine status, and give us the direction whether that school needs another 25 days exclusion. As a school system, if we didn't have the backing of Public Health, I shudder to think it would be very difficult. This has really been an eye-opening experience for a lot of people, I think. We've always said that if we should have an outbreak of a vaccine-preventable disease, that your child may be excluded from school, and now it's really happened. How does that feel? Is that tender? One of the districts up north of Seattle had their first case, and that student had attended a football workshop in Auburn. It just travels. So you can see how it quickly spreads throughout the state. I think public health has a really important role in protecting the community. Public health really is essential.
I had a cough that wasn't really associated with a cold, and I was short of breath, and then I started waking up in the middle of the night in a cold sweat. I had gone to the emergency room and got kind of shut into the room, and they said, "You have tuberculosis. You need to stay here for the rest of the day." I said, "I think you mean I have pneumonia." I did not have walking pneumonia. I had tuberculosis. How? Apparently, I had picked this up in the Philippines 5 years earlier, and it had been latent ever since then. I was sick with some other things that had kind of stressed my body out, and that set off the tuberculosis to become full-blown tuberculosis all of a sudden. I found out I had a hole in my lung. I was told I would live a long and healthy life, which sort of surprised and scared me because I didn't know that was a question. But I had to call my boss and say I can't come back to work for an indefinite period of time. If I go out of the house, I have to wear a mask, which was not very fun. Note that when you're in isolation and you can't see or talk to anyone for a few months, the TB clinic people become your only friends for a little while. After I got diagnosed, I had to tell public health officials, everyone that I'd been in contact with for more than 8 hours in an enclosed space, I had to give them their name and contact information. And because public health did this very thorough screening, they unveiled 2 other cases. I transmitted this contagious disease to people who were close to me.
Providence Mount St. Vincent is what you might call a senior residential community. We are a skilled nursing facility that has about 340 frail older adults living in assisted living. We also have a residence for retired Sisters of Providence, and we have a large child daycare and early childhood education site. Since September, there have been flu outbreaks in more than 40 skilled nursing facilities in King County. Every year is different. This year might be among the worst. We started out with 1 case of flu in our assisted living, and then fairly shortly after had a few cases in our post-acute rehab unit. And I need to check in with public health to understand what's happening in the larger community.
Public health, how are you today?
I have relationships with the public health nurses who support skilled nursing facilities. And I feel like I can tell them anything, and they will tell me what I need to know, even if it's not what I want to do. Our relationship with government is a two-way street. They provide a lot of oversight of everything that we're doing here, but we also rely on them to provide data and resources to help us provide the care and services that we do.
You're here for the Max Clinic?
Come on in. Come on in. Hey. Hi. How you doing, Mark?
I'm all right.
So I'm a medical case manager working specifically with the population of HIV patients who have not been able to engage into care in a traditional treatment model. So maybe they can't show up for appointments. What I do is try to engage them and help them navigate through a variety of different psychosocial type of barriers like significant mental health issues, substance use issues, and the big one here in Seattle, homelessness. It's been around only a couple years. It's been really successful. We have I think about a 64% viral load suppression for the Max Clinic patients. And that's a group that were referred and brought onto the Max Clinic caseload because their viral load hasn't been able to be suppressed elsewhere. It's really an aggressive approach taken to develop the Max Clinic and bring public health employees together with some Harborview employees. Both sets of employees are part of the HIV service community. So we really all have the same goals in mind. So really it's just we feeling like part of the same team. To know that what I'm doing with my career is trying to help people. So I just feel pretty fortunate to be in a position now where I just have this unique opportunity to work with folks who need help the most. To the credit of public health, in a community where there are already very robust HIV services, they took the time to think about how do we still get at the folks who still can't access the services we have in town and create a program that is sort of modeled to meet their needs and meet them where they're at. Do you know if you're on like any housing waiting lists? We need to keep trying to develop new models and not just get stuck in this large overall treatment model and make everybody fit into that. And so it's a way to adjust the model to meet the needs of a really specific population without having them jump through all the hoops that they might not be in a position to get through.
So how likely would it be for me to pass hepatitis B to the baby?
If your viral load goes up, it will.
I'm an infectious diseases doctor, so a lot of what I treat are chronic viral infections, Hep C, HIV, Hep B. And so I spend a couple of days a month down at the clinic in the International District, where I would say 80% of my patient population down there has Hep B. 98% of them, I would say, were born in another country. Hepatitis B is transmitted through blood or through sexual fluids, and it can be transmitted from mother to child as well, often during delivery, but perhaps in utero also. To prevent pregnant moms from passing on the virus to their children, it's really important to identify those moms who have the virus, because once you identify those moms, you can educate those moms and you can reach out to the providers who are going to be delivering the babies, because we have a really effective way to prevent perinatal transmission. Perinatal transmission shouldn't occur because we know how to prevent it. In large metropolitan areas where there are many people who are from areas where hepatitis B is common, most providers are going to be aware that this is an issue and will be screening their moms. But in other areas where there perhaps isn't as much hepatitis B, providers are simply unaware. If you're not aware, you're not going to test. And if you don't test, then you don't know. And then even if you do find out, it may be that the place where the mom delivers may not be aware of the types of actions that they should be taking. And so education would be key.
So I just wanted to make sure that the child received their birth dose of hepatitis B immunoglobulin and hepatitis B vaccine.
I think public health plays a huge role because prevention is really the answer. We just have to get the knowledge to the provider so the provider can act on it. This is huge, because we're talking about a chronic viral infection that somebody's going to carry for the rest of their lives that is preventable. If you think about the cost of treating one case of liver cancer, or the cost of one liver transplant, I think would pay for preventing all the perinatal transmissions of hepatitis B in any given state. So it's a pretty easy intervention. It's really just getting the vaccine, getting the HBIG, getting it to the facility where the mom is going to deliver, educating the provider that, hey, this needs to be done. And, compared to all the things that are done after a baby is delivered, these are relatively minor and easy things that can be done. And then you've really had a huge impact on that child's life and prevented that child from being able to go on and pass that infection on to somebody else. The incidence of hepatitis B in this country has come down dramatically. We're just about there. If we could eliminate perinatal hepatitis B transmission, we could eradicate hepatitis B. It's definitely in the public interest. We don't want any unnecessary infectious diseases out there. We have so many that we can't prevent. Let's prevent the ones we can prevent.
We got your lab results back, and it does show that you have hepatitis C. Your viral load is positive, so
we're pretty sure that I contracted Hep C through this tattoo when I was 17 years old. And I did not even know I had Hep C for most of my adult life. So the things that I thought were normal, like waking up with headaches or flu symptoms, I thought that was the way everybody woke up. From the time I found out what the Hep C was doing to my body, I decided that I was not going to let it destroy my body. I am the only person that we know of to have gone through 6 complete protocols. And we started off on the interferon and ribavirin. Interferon devastated me. It was like, there was one point where I actually became suicidal. I was just so done with feeling bad. The ability to access the new drugs, thank God. I mean, it's a great drug. When Dr. Scott called to tell me that I had cleared after 30 days, I was with my godson, and we both flipped out. 22, 23 years. So it was good to know that I'm not going to die of liver cancer. My experience with the healthcare system, everybody has been absolutely amazing. The commitment of people, they want you to kick this. They want to cure you. They want you to walk out and be healthy.
So this is the death certificate, and at the top part of the death certificate is called the demographics, and basically that's the information regarding the decedent. It has information of the name, the date of death.
The partnership that I have with the medical examiner's office, I've observed them in traumatic, terrible situations, and the investigators are some of the most caring and compassionate people I have ever met. The way they handle a family in these traumatic situations, the way they ask the questions that need to be asked that are very intrusive questions, and yet do so in a manner that makes the family want to give them that information. And they're not just a case number, they're people that they are handling. And they always tell the family, your loved one is in my care and I'm gonna treat them as if they're my own. And that's not just something they say, because I've watched them. It's something that they actually do. Investigator Monty Nelson and I had to go to a house after a fatality car accident, knock on their door to tell the family that their loved one had been killed in this car accident. And when we arrived, it was a Middle Eastern family. They had a lot of people there in this little community. It gave the family the news in the most comfortable and most compassionate way that we could possibly give it to them. They took the news extremely hard. Monty asked, is there anything in your culture that we need to do to help you with your son's death? Teach me what I need to know so that I can handle your son in the most caring and professional way, and honoring your culture and honoring your belief systems. It was phenomenal, the way that he handled that particular situation. People don't think about or want to talk about the day that they die, because it's a tough subject to broach with somebody. Death and life kind of run hand in hand together. So when that time comes, who's gonna be there for your family? Who's gonna be there to put an arm around you and tell you that we're gonna get through this together? Who's gonna be there that says, this is what happened to your loved one and why?
Go, 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 you know that?
I'm an infectious diseases doctor, so I interact with public health fairly often, with hepatitis, but also with measles, and when we were working with Ebola, other things. And it's a real team approach. We have certain knowledge, you have certain knowledge, working together, we approach the same problem from different directions and provide a solution.
I think public health is so important in our community. It's vital for all of us.
What I learn or what I gain from public health serves, protects, makes more happy our 340 or so residents. And the health of our community is better because of it.
We all know that it's morally and ethically good. I mean, as Washingtonians, the reason we live here is because we cover each other's back and we take care of each other.
Everybody, no matter who they are, deserves to be treated with dignity and respect. In life, maybe they made bad choices, yet at the same time, they're a human being. They're somebody's son or daughter, somebody's mom or dad. They belong to somebody. Their life means something.
You know, getting the opportunity to serve a really marginalized group of folks is a great honor.